We're going to be talking about the COVID crisis and seniors in long-term care facilities. Literally, we're dying because we're trying to take care of our seniors, and they're the most important people in my lives right now, besides my awesome team. So I have no disclosures. None of us have disclosures. We're all above par. So a quick brief on my team at Northwestern Geriatrics. We've brought in $28 million in research funding, and we are ranked number 7 nationally. So we're not hacks, we're a solid team. In 2013, we only had 2 geriatricians, and that's when I became chief of geriatrics. And I've grown our division with an excellent group of individuals so that in 2020, we have 6 geriatricians and 1 nurse practitioner. What troubles me the most, keeps me up at night, is that in 2020, during this COVID crisis, I've had 4 of the people in this photograph have COVID exposures and quarantines, and 1 has had a repeat. A lot of this is due to some of the struggles that we're having in acquiring PPE and testing. So moving on, the big issue that we're seeing is COVID in nursing homes. So I understand it. No one likes to go to a nursing home. No one talks about nursing homes. None of my senior patients want to go to nursing homes. And so it's been such an issue that as an industry, we've actually renamed ourselves. So we're calling ourselves now skilled nursing facilities, and this has been for several years now. And so a quick study on long-term care terminology. Skilled nursing facilities, we usually are most familiar with them for providing subacute post-rehab, post-hospital discharge, as well as long-term care for people who can no longer remain in their own homes. Skilled nursing facilities offer 24/7 nursing as well as physician oversight. Myself or one of my team have to go at least once in the morning to see patients there. And then we'll have to do admissions, and we'll have to do daily visits and so forth. There's 1 nurse for anywhere from 10 to 60 patients at most of these facilities. What's interesting is that skilled nursing facilities, Medicare is our major payer. So we have a lot of federal regulations. What the term that we hear the most is that nursing home care has been the 2nd most federally regulated industry in the United States, with the first being nuclear. Now, because nobody wants to go to a nursing home or a skilled nursing facility, our industry has developed other means of keeping people safe. So there's assisted living. Assisted living is a dorm kind of environment with a meal plan. And then independent living, which are senior apartments that may or may not have a meal plan. And on both of these, there's usually a nurse available in a health center, sometimes between the hours of 9 to 5, sometimes not on weekends. There's no requirement for a 24/7 nurse. And there's also memory care assisted living or memory care independent living. With these, what you'll usually see is a living room or a congregate living area, and then rooms around the outside where people will live and then come into the main area. Some places they'll have people hire 1-to-1 paid caregivers to help with individuals. Usually these are people that cannot live in their own home or have issues with agitation and dementia. And then, because our industry is always evolving, assisted living and independent living was state regulated and it was also under private pay. And with those state regulations, most of those, and we were talking about this, most of the assisted living regulations are sort of healthcare focused. You know, do you have enough people there and so forth? But it's state regulated, so there's a wide variety in the regulations. Independent living is also your Wild West. I like to call it, just primarily because there's not a lot of regulations. These are apartment buildings, and there's not a lot of mandatory reporting incurred by the state. And so to limit even further the number of regulations people have to do in this industry, they've also come up with another term called supportive living. Supportive living used to be non-regulated because it didn't fit the guidelines of assisted living and independent living. But nowadays it's getting a little bit more regulated. But the skilled nursing facility, which is the top part, is actually Medicare, federally regulated, tightly regulated. The lower half is actually state regulated. A lot of these regulations entail, you know, OSHA, environmental, and more of a hotel kind of industry. So this comes into issues when we see what's been happening with COVID. So skilled nursing facilities were the first to experience COVID outbreaks. We hear this from Washington State. from New York. And what's interesting and what I find extremely disturbing is that for people over the age of 80, they were accounting for about 10% of the cases, but we're seeing anywhere from 50 to 60% of death among my people. And I've lost a lot. And so we've seen it hitting the news in New Jersey and Fort Lauderdale, but in Illinois, it's been kind of off the news until this week and last week. So I think in the news, there's only about 2 facilities that got publicity. But if you want to know how many long-term care facilities have COVID in Illinois, the answer is 305 in the state of Illinois are COVID positive. So as of April 15th, 305 long-term care facilities reported COVID, and 296 residents of nursing homes died. And the deaths have taken place at 125 long-term care facilities. So this is major. 25% of Cook County COVID deaths are long-term care residents. And up until April 19th, statements had come out. And one of the reasons why we don't hear much about it up until this current week is that the Illinois Department of Public Health was withholding the names of the facilities as a matter of patient privacy. This was frustrating me as a physician because I would have patients at independent living facilities where I would ask, is there COVID there? The patient's having fever and shortness of breath. And I was told that they could not tell me because of HIPAA. That patient came back COVID positive, and then the nurse relayed later that her neighbor also had COVID. So as of April 19th, which was Sunday, the IDPH agreed to weekly release the long-term care facility names with lab confirmed COVID. And that's where we know that there is now 102 COVID positive facilities in Cook County. If you want to know if the places where your family or friends or patients are at, if they have COVID, there's the link right there. The link gives you this, and you can see that there's places that have 15 confirmed cases, 4 deaths, 24 cases, 7 deaths. And so we are seeing a lot of outbreaks in the nursing homes. What I found fascinating too is that I don't believe this is mandatory reporting for the independent living because there's several independent living facilities that are not listed. They might just be reporting as a nice city. So this number is likely an underestimate. What I've been hearing a lot from the hospital side is that the average age of Northwestern medicine hospitalized COVID patients are 60 years old, 65. The average age of the long-term care facility COVID patient is 88. I have some people that are 95. There's a 99-year-old. And this is a patient that I have who's a 91-year-old SNF resident. She's had a fever of 101.2, chills, shortness of breath. The NM algorithm recommends transferring the senior to the Northwestern ED for COVID testing. I like that. I want to get them out of there. But the issue that we're having is that the family refuses transfer. In the nursing home world, the family and the patient's rights are superior to everything. So when the family refuses transfer, they authorize a do not hospitalize order. Many of you guys might not be familiar with this order, primarily because they don't come into the hospital and they're not seen in ambulatory most of the time. So what we've been doing over the past month is we're treating in place COVID patients. So I'll be able to get a chest x-ray, which shows a bilateral pneumonia. The respiratory panel's negative. We get low white counts, elevated LFTs, worsening kidney function. My clinical suspicion for COVID is extremely high. So I would love to order COVID testing. The issue is that COVID testing in the SNFs and long-term care facilities is a Sisyphean effort. I've been pushing that rock up the mountain for a month now. So what happens is that as a skilled nursing facility, we contact Illinois Department of Public Health with a possible case. Our providers of lab services have not been able to provide COVID services or COVID testing, so we contact IDPH. IDPH does not provide swabs or collection equipment. You must procure the swabs and collect the specimen yourself. We're having issues with this because there's shortages of swabs everywhere. Once you're able to find a swab and a collection equipment or test kit, the IDPH will run the specimen in their lab, but you have to drive it. So skilled nursing facilities have to find some way of finding these swabs, collecting the sample and driving it to the person. The biggest issue that I've seen is people are unable to get the swabs. And so when I've been on the phone and when people have been on the phone with IDPH and I tell them we've got a patient who does not want to go to the ER or the ED, recommendations that I've gotten from different people on the phone is to take the patient to a drive-through for testing. which I don't know how I can do that physically with a 95-year-old in a hospital bed with bilateral pneumonia. And then we've also had recommendations to forcibly remove the patient and transfer to the ED, potentially using Chicago Police Department to remove my senior from the nursing home, which I would not do. I feel like that's cruel. And so what we're doing is treating in place as a presumed positive. These patients are not going to be registering on that website because those are only reporting COVID confirmed cases. So what I have to do with treating in place, and I deeply appreciate a lot of my colleagues in the hospitalist COVID service who've sent me different information on how to treat in place, is that most of these patients end up going to hospice. So the other issue that we're having with treating in place is the issues with isolation and PPE. So most nursing homes and long-term care facilities are experiencing severe PPE shortages. We have enough supplies for 2 weeks, but since we're already a month in, it's been a little piecemeal. So what we're seeing across the industry, and especially on Med Twitter, is that staff members and physicians in nursing homes are getting affected and getting sick and dying. And as a chief, I don't want my people to die. So for the past month, we've been the forgotten frontline on the skilled nursing facility and long-term care community. Our first SNF COVID case was March 10th, 2020. What I've had to do is rotate geriatricians depending on quarantines. Like I said, I've had 4 physicians be on quarantines. I don't have a volunteer backup list. I understand that, and people are needed other places. We've cut back on inter-facility in-person care. So one physician goes to one hospital, or one nursing home. We don't have patients, or we don't have physicians seeing COVID positive patients and then going and seeing patients in a COVID naive facility. We've been very thankful. Northwestern actually approved a PPE supply for geriatricians on April 13th. That is awesome. Thank you. And another complicating issue that we have coming through the pipeline is that there's been a state order that SNFs have to accept all hospital patients regardless of COVID testing. And so there still are several COVID naive facilities out there, including one that I work at, and we're still, many SNFs are lacking PPE. So I just want to give a shout out to everyone who's working in our skilled nursing facilities, because it really is about our seniors. These are the bravest people going in to take care of our seniors, and our seniors are really suffering during this COVID epidemic.